lung surgery department in Beilinson, and we perform here all kinds of thoracic surgery, from newborns to adults, including lung transplantation. We are the only center of lung transplantation in Israel, and we are one of the most active lung transplantation centers in Europe. Perform around between 50 to 55 lung transplants every year, and according to the International Registry of Heart and Lung Transplantation, we are one of the biggest departments in lung transplantation in Europe. Our main activity here is oncology, and we perform all kinds of oncologic surgery in the pleura, lungs, mediastinum, including big resections of lung with left atrium, with great vessels in the cava and the aorta. We perform plastic surgery of the trachea and the main bronchi. We perform operations for mesothelioma, that's extrapleural pneumonectomy, including lavage of the pleural cavity with hot chemotherapy. And beside these big and traumatic operations, we have a very nice activity on video-assisted thoracic surgery with minimal invasive techniques, including robotic surgery. We have performed several operations already on lobectomies and thymectomies and resections of mediastinal tumors with a robot, and also all kinds of video-assisted procedures, lobectomies, segmentectomies, that we can perform in the chest. Well, the biggest change is in the size of the incisions. Till 20 years ago, we had to perform a lobectomy, the resection of a lobe of the lung, or any thoracic procedure with a huge incision of 20-25 centimeters. That was very painful for the patients, and with a lot of risks of infection and pneumonia after the operation because of the pain. Nowadays, we perform most of our operations with video-assisted thoracic surgery. The introduction of the video camera inside the chest, and nowadays introduction of the robot inside the chest, allow us to perform operations with very, very small incisions that are very painless. The patient doesn't need almost any analgesics, and the recovery is much faster with the same oncological results, and the patient can go home after 2-3 days, no more than that, for home. Well, special operations that we perform, I can enumerate as, first of all, lavage of the pleural cavity with chemotherapy, with hot chemotherapy in patients who have mesothelioma disease and stage 4 of thymomas, that we perform resection of all the tumors, and after we wash the cavity with hot chemotherapy. Surgical procedures that are new in our armamentarium is the robotic surgery that we do, and also all kinds of video approaches, and now we're changing for the less invasive of all video approaches. That's the single port thoracoscopy, that only with a single incision, where we put the thoracoscope inside the chest, we can perform lobectomies, segmentectomies, and all kinds of major thoracic procedures. Well, we are a world referral center for thoracic surgery. We receive patients from all around the world. There is no kind of thoracic operation that we cannot be performed here in Beilinson. The advantage to work in the department is like this, is that we have the help of our cardiac surgeons that work together with us, especially in cases that we use a heart-lung machine, and in complex resections of lung and parts of the heart or great vessels together with the lung. This is the advantage of working in a big center like we have, and all the support of all the imaging that we have here, like PET-CT and MRIs and our intensive care, and also something that I didn't mention before, we have the Israeli Referral Center for ECMO, for extracorporeal membrane oxygenation systems. We have 6 machines of ECMO in our department, and we can put patients with respiratory failure in these ECMO machines until they recover from their lung injuries. And sometimes these machines can help us in our surgeries also.